Hello everyone. Today, I will prepare a detailed video about what we should expect in a baby's second month. Specifically during weeks 8, 9, 10, and 11, we will discuss developmental milestones, warning signs that require urgent medical attention, which vaccines should be administered and why, where babies should be in terms of developmental stages, and the key points parents need to pay attention to. Let's get started right away. You may remember from our previous weekly development videos that we talk about the baby's first smile, the beginning of colic pain, establishing a feeding routine, and making plans for the future. The topics we'll cover now are a continuation of those videos. Starting from the second month, the posterior fontanelle, the soft spot at the back of the baby's head, is expected to close. Normally, babies have two fontanelles, one on the top center of the head and one at the back. The posterior fontanelle should close by the second month at the latest. If it remains open beyond this period, you should consult your doctor. Feeding should now be more regular. Waking up 1 to 2 times at night is considered normal at this stage, while 3 to 4 daytime naps are also normal. You should have started tummy time exercises, and your baby should be able to recognize familiar faces, especially parents. You may notice this as increased arm and leg movements and smiling when your baby sees you. Remember, babies have until around 12 weeks to establish sleeping through the night. By the end of the second month, many babies begin sleeping longer at night. If your day-night rhythm is still not established, I recommend being patient until the end of the second month. By this time, your baby should have gained approximately 1 to 2 kilograms. Head circumference should increase by 2 to 3 centimeters, and length by 3 to 5 centimeters. These are average values and may not perfectly reflect your baby. The most important factor is continued growth along the percentile curves, which your pediatrician will monitor regularly. Development is a process. A single measurement alone cannot define whether development is good or bad. Your baby's muscles are now stronger and purposeful movements increase. Conscious and goal-directed movements become more balanced. In some babies, the posterior fontanelle may still be slightly open until the end of the second month. If it remains open beyond this, your doctor will evaluate and order further tests if necessary. Feeding is well established by now. Since babies are not yet crawling or walking, weight gain may be more noticeable. A key note here: excessive weight gain in breastfed babies does not require intervention. Even if a breastfed baby gains 2 kilograms, no restriction is applied. Breastfeeding should continue. In terms of brain development, babies should start cooing or making soft sounds, which is an important part of communication. Respond to these sounds. Your baby is trying to communicate with you. Facial recognition, smiling at parents, and social interaction should also be present. If smiling or recognition is lacking, inform your doctor. Now let's talk about warning signs that require urgent medical evaluation. Not recognizing faces. Difficulty tracking objects horizontally. Poor head control. Concerns about feeding adequacy or insufficient weight gain. If these are present, your doctor may recommend further evaluation. Every baby is different. There is no single rule that applies to all babies being calm or fussy. What matters most is avoiding harmful practices. Babies naturally seek closeness with their parents. When your baby cries and you sense a need, pick them up, comfort them, talk to them, and interact. We strongly recommend baby carriers, kangaroos. Even if head control is not fully developed, Using a carrier with minimal movement is beneficial. It increases bonding time and supports immune development through healthy microbial exposure. Babies still sleep about 16 hours per day during the second month, with 3 to 4 daytime naps. Nighttime waking 1 to 2 times remains normal. Common issues and practical solutions. Sneezing. Check for dust, strong odors, cigarette smoke, heavy perfume, chemicals, or pets that may cause allergies. If suspected, remove the trigger. Also ensure regular nasal cleaning to reduce the risk of sudden infant death syndrome and lower respiratory infections. Oral thrush monolysis. White patches in the mouth are caused by Candida albicans, not milk residue. Do not give water after feeding. Initial treatment is oral care with baking soda. If unresolved, your doctor may prescribe an antifungal medication, e.g. Nicidin. Important note, treat both the baby's mouth and the mother's nipples, as reinfection can occur. Neonatal acne, caused by maternal hormones. No treatment is required. It resolves spontaneously. Physiological reflux, common in the first 4 months. If weight gain is adequate, no medication is needed. If vomiting is excessive, feed smaller amounts more frequently. The stomach capacity at this age is about the size of an apricot. Blocked tear ducts. Eye discharge is common. If severe, antibiotic drops may be required. Otherwise, breast milk and massage may help, provided the mother does not have infections transmissible via breast milk, e.g. HIV, hepatitis C. Diaper rash. Keep the diaper area dry. Change diapers frequently. Avoid excessive wet wipe use. If used, ensure the area is dry before closing the diaper. At home, clean with water. Avoid soap every time. Preventive creams help prevent rash, but do not treat severe cases. Infections and fever. In the first 3 months, fever requires hospital evaluation. No cold syrups are approved under age 2. Only fever reducers may be used when appropriate and prescribed. Feeding notes. Continue exclusive breastfeeding or stage 1 formula. No additional water is needed. Check expiration dates of formula and inspect feeding equipment for damage. Pacifier use is recommended after the first month. The American Academy of Pediatrics notes it reduces the risk of sudden infant death syndrome. Swaddling is appropriate until 5 to 6 months, but only place babies on their backs when swaddled. Safety and follow-up. Use appropriate car seats. Never carry babies on laps in vehicles. At the 2-month checkup, weight, length, and head circumference will be measured. Hip ultrasound should be completed at this stage, if scheduled. Vaccination, 2nd month. BCG, tuberculosis. DTaP, diphtheria, tetanus, pertussis. Pneumococcal conjugate vaccine. Haemophilus influenza type B. Vaccines are essential. Tuberculosis remains one of the leading infectious causes of death worldwide, with approximately 80,000 children dying each year due to lack of vaccination. We also recommend the rotavirus vaccine, which is optional but beneficial. Take care and see you next time.